you, it's so nice to be here and see all the energy that I get the sense that people are really finding the information you've heard so far today very helpful and empowering, and so it's great to be a part of this. And I do have one housekeeping announcement too. I met a very nice lady in the lobby who has lost a cell phone. So if everybody could kind of be on the lookout for a stray cell phone and bring it to the main table, that would be much appreciated by this woman whose life is now falling apart because she has no idea where she's supposed to do at the end of the afternoon and how that goes. So the title of my talk is Integrative Medicine for Cancer Wellness, but what I really wanted the title to be was Integrative Medicine, What the Hell? So what the hell is integrative medicine? So what are we talking about? A lot of times I think when people hear there's going to be a talk about some sort of alternative medicine, they expect the speaker to look like this, a little bit like a witch doctor. But truly there's a couple of terms floating around out there. So one of them is CAM, and that stands for Complementary Alternative Medicine. And originally, the first term was alternative medicine, and this was just to reflect therapies that were traditionally part of a U.S. hospital or traditionally taught about in the U.S. med school, so things like chiropractic, acupuncture, massage, and so forth. And then the term complementary came about to reflect the way that most people use these therapies. So most people who are seeking out an acupuncturist, for example, are also going to see a conventionally trained MD or DO and taking part in conventional health care. It's only about 10% of people or so who use these therapies who are truly using them as alternatives. So the term complementary reflects that people are using them to complement each other. And I do like to point out, though, that complementary is spelled with an E here and not an I. So what does it mean when you spell it with an I? Like giving a compliment. So hopefully all my physician colleagues are practicing good complementary medicine, telling you look nice today, I'm glad to hear you're walking again, and that sort of thing. It also can mean free. And that's one thing I do want to acknowledge is that a lot of times these therapies are really far from free. And so I like to take that into account when discussing things with people. So there's another term, lifestyle medicine, and that's the use of things that people can do for themselves to really help their health. So stress reduction, exercise, nutrition, good night's sleep. And integrative medicine implies that not only is the patient, for example, going to the acupuncturist, going to the physician, going to the physical therapist, doing stress reduction, doing some exercise, but everybody involved is talking and coordinating the care on the behalf of the patient. So that's the term integrative medicine, and that, of course, is what we're trying to do at the Center for Integrative Medicine. So when you come see us, if you're a patient in the system, your care is seamlessly integrated because we're all part of the same electronic medical record. If you're a patient from outside the system, we'll send a letter to any of the other providers that are involved in your care or who you want to make sure are up to speed with everything that you're doing. So I thought I would just give you a case to start thinking about what's a typical person who might use integrative medicine. So Mrs. Jones is a 54-year-old healthy postmenopausal woman who's been recently diagnosed with a triple-negative stage 3 breast cancer, and she's been told that the next steps for her are chemotherapy, and after chemotherapy she'll have a mastectomy and then followed by radiation. And so she's got all these questions that would be considered to be kind of integrative questions. She wants to know, should she take supplements? Should she eat organic? Is there a role for acupuncture? She's been getting massage for years. She loves it. Is that bad now that she has cancer? Is massage going to spread the tumor? And then her neighbor said, you need to have your colon cleansed. And her neighbor from Weehawken calls up and says, you can't do chemo, it'll kill you. And she starts to get all this advice. So this would be a typical person that we would see in integrative medicine. And when I sit down and talk with people about using an integrative approach, my first thing that I want to do is actually not on the slide, but I want to make sure that they're plugged in with conventional health care. They've got some good resources. And so I refer a lot of folks to our cancer center and to some of the programs that they have as well. And then I like to make sure that the things they're interested in aren't harmful and spend a moment or two talking about things that I would really try to dissuade them from doing. And then get into the fun stuff, talking about things first that people can do for themselves because it gives people a lot of power and control to be able to have a difference in their health that they're personally responsible for. And a lot of these things, sleep, exercise, mind-body therapies, nutrition, are free. So I like that too. And then certainly with the patient in their particular situation, I want to consider the safe and plausible complementary therapies. And I'm going to spend some time talking about each of these things today. So a brief note about harmful therapies. First, I have to show you this cover of Weekly World News here with Princess Di on the cover, and it says, Di cures all her ills with a weird water therapy. She has her bowels washed out with 12 gallons of water 3 times weekly. Now she's free from tiredness, anorexia, headaches, allergies, depression, and candida. So what was Princess Di doing that I would have tried to talk her out of? Pardon me? Colonics, okay, so colon hydrotherapy. So certainly there is a role for colon enemas if you have severe constipation. If you're going to have a colonoscopy, you need to cleanse the colon out. But in the alternative medicine world, this is one of those detox therapies where you'll see these ads that say, John Wayne died with 10 pounds of undigested fecal material in his colon. And you start to make this leap of logic, wow, if John Wayne had his colon cleansed, he might still be here with us today. But I'm sure a lot of you in the audience have had colonoscopies, and you know that if you've seen a little bit before you went to sleep, you notice that your colon is nice and pink and clean, and it doesn't look like a gunked up sewer by any means with hard water deposits or anything like that. So the colon does actually, also I like to point out, the colon does a good job of cleansing itself. So it's said that about every 3 days, your colon turns itself over, so the cells are really rapidly dividing, which is why that chemotherapy can be so hard on the colon, because it gets those rapidly dividing cells. But the colon is cleansing itself pretty well. And then you've got all those good bacteria that are living in your colon that we've all heard about now, that are helping us metabolize things and take care of toxins themselves. So why do you want to do like Princess Di did and rinse everything out? Because then you kind of have to start over. So I think, so there's not a lot of plausibility to why a colon hydrotherapy might improve health, but it's on this slide because it's potentially dangerous. So can anybody think of some potentially harmful effects from having a large volume of a hypotonic solution go into your colon with a permeable membrane and blood, a hypertonic solution on the other side of that membrane? Chemists in the room? So I've heard a few things. Yeah, so rupture I heard, and that's definitely a potential problem. What else?
It cleans out the good bacteria.
Cleans out the good bacteria. I think that's a good point, absolutely. And then I saw a woman when I was working at Pres St. Luke's a long time ago who was doing colon hydrotherapy to try to treat her breast cancer, and actually had dropped her sodium level a lot because the water that was going into the hydrotherapy was diffusing across her colon. Her sodium was so low she was seizing and spent a couple of weeks in a coma until they could fix that. So the fluid and electrolyte disturbances are possible. And then infection too. There was a really notorious case on the Western Slope about 20 years ago where a guy was doing this but not cleaning his equipment properly between patients. I love giving this talk after lunch. sorry. But it actually triggered the CDC to come figure out what was going on because people were dying of these weird amoebic infections all over the country, but they'd all gone to Montrose to see this healer. Anyway, I'd like the talk to get more fun now, so I'll just briefly mention a couple of other things. And just due to time, if you guys want to come back and talk or ask questions about some of these other things on my list, I'm happy to. But I think restrictive diets, so this one can get folks with cancer in trouble because you always hear that what you eat does affect your cancer, and I honestly believe that. You heard about it if you went to the Health and Wellness Center. Absolutely true, but if you restrict your diet down so you're only eating lettuce, for example, because you're worried that everything else has a drug interaction or is feeding the tumor somehow, you're not feeding your own immune system, and you can get into trouble. Certainly some supplements are toxic, and I alluded to the case of financial toxicity before, but I think that's something that we need to be aware of. And then every once in a while, maybe once every couple of years, I'll have somebody come see me in integrative medicine who's been told they have something that's very curable. For example, a stage 1 breast cancer or a pre-breast cancer, and they've been told that if they have surgery to remove it, that's all they need. But they say, I don't want anything invasive. I want to treat it with alternative medicine. But folks who go down that path, then that gives the cancer time to grow. We don't know for sure that there are any alternative medicines that can actually treat the cancer as well as our conventional treatments can. So I say, if you've got something that's curable, go big guns on the conventional approaches, and then use what I'm going to show you next as some things to support you through your treatment. And a little word on detoxification, because that comes up in alternative medicine circles a lot. And I just, again, give the body a lot of credit because we're very well evolved to get rid of toxins, and all we need to do is support our body in that process. So drink plenty of fluids, exercise, don't put a lot of toxins in the first place, stop smoking, drink less alcohol, don't breathe the exhaust pipe from your car. But it's more than just the colon, it's the skin skin, the lungs, the kidneys, the liver, all of these organs are really taking care of detoxification for you. And if you want to be really natural, let the body do what it's good at and support it. So the therapies I want to spend a couple of minutes talking about are the lifestyle approaches and CAM approaches. And this cartoon says, I have to say I had a different impression of what Reiki is all about. So this is not what Reiki is all about. I can tell you about Reiki a little later. I like to point out with everybody, when I speak with them, talk about how their sleep is going. And if they're getting a good night's sleep, there have actually been links between poor sleep and breast cancer, for example. And then certainly, we've all experienced sometimes in our lives where we haven't been sleeping well, and you'll notice that your resistance or your resilience is really impacted. If you've had a few bad nights of sleep and somebody looks at you funny, you might burst into tears, where if you have had some good sleep, that might not happen. So sleep is really key. And so I try to help people get sleep as much as possible, and I start with the least invasive and then sort of work my way down. But grandmother tips, what would your grandmother tell you? Sleep in a nice, comfortable room. Don't eat or drink right before bed. Get some exercise early in the day. Make sure your room is comfortable, things like that. Short-term medications, I think, are okay. Acupuncture can help people sleep. Massage can help people sleep. There are some supplements that are worth a try. I'm a fan of melatonin because it actually may decrease estrogen, if anything, so it potentially has a role there. Valerian, though, is basically like a benzodiazepine, so if somebody wants to take valerian, I'd rather them take a prescription where I know a little bit more about the consistency from batch to batch of what they're getting. And you might have heard of kava for sleep as well, but I don't like kava because it's got a big track record for liver toxicity, so avoid that one as well. Mind-body techniques, learning relaxation techniques can be very, very helpful. And I just recently, in the last few months, found this resource. The American Academy of Sleep Medicine with this website has lots and lots of resources for patients on how they can get a better night's sleep and why it's so important. And I do want to also point out that some of these things are on the handout. So in your packet, there are take-home points from each of the speakers. And so I do have the address of the sleep folks on that handout, so you've already got that. We also have a sleep clinic here at the hospital that doesn't really focus on sleep apnea like most sleep clinics, but they focus on the primary insomnia, secondary insomnias, and other sleep disorders, so they're a great resource as well. So exercise, you're going to have a talk about exercise that is going to be fabulous, but I'm such a fan, I couldn't help myself. I had to sneak a few exercise slides in here, because exercise in cancer, the research is just incredible to show that exercising before you have a cancer diagnosis reduces your chance of getting the diagnosis in the first place. Once you've had the diagnosis, exercising after the diagnosis, especially shown for breast cancer, can reduce the chance of it coming back, or reduce the chance that it would be something that would kill you if it comes back too. With these kind of numbers, if we could make this into a pill, it would be a blockbuster. I mean, these are incredible numbers to be able to reduce risk of recurrence 30% and mortality 50%. So you're going to hear about exercise later on this afternoon. During and after treatment, exercise has a role, and again, Ryan's going to talk to you guys about all the different things that they know from all the research that's been done at UNC. But it can prevent weight gain associated with treatment, best treatment for fatigue, but you got to modify it when you're going through very fatiguing treatments. It improves stamina, balance, anemia, immune system function. This is my mom doing her cardiac rehab a few years ago. She's adorable, so I have to include her. Everybody else includes their kids. My kids are teenagers, so they have no place in my talk anymore. Exercise can be helpful for pain management. It's also associated with decreased hot flashes, improves memory, concentration, sleep, depression, and then anything else that you might want to help exercise always rises right up to the top. So I like to tell people that, unlike other late night TV claims, because I sound like I'm trying to sell you something, this one can help you drop 20 pounds and improve your sex life. So cancer exercise rehabilitation, I'm a big fan. I always talk to patients about exercise. Mind-body is another therapy that, with a little bit of initial training, you become something you can do for yourself, get some control, something you're doing to take better charge of your health. Very safe, often covered by insurance. So our psychologists in integrative medicine, they do all kinds of mind-body therapies with people. So they're not lie on the couch talking about your childhood kind of psychologists. They're very concrete, goal-oriented, skills-based kind of psychologists. So you come in, you learn a new skill, whether it's biofeedback or a relaxation technique. You practice it at home, you come back the next week, You do that maybe 5 or 10 visits, and then you're good to go, and you've got a whole new set of tools in your toolbox. And I have to also mention, I always get questions about medical marijuana because people assume that the integrative medicine doc is the one to ask. And I think, people say, it just helps me relax so much. And I said, but you can't take it across the border. What about this? This, you get a new toolbox right here. You can take that across the border, no problem. So medical marijuana, mind, body. There's a whole host of things that would fall under the umbrella of mind body therapies, and you see a little bit of a list here. So the things on this list are things that are available that our psychologists teach, or also available at the Cancer Center. So they've got some art therapy and music therapy things going on there. And this cartoon says, the light in me acknowledges the dimness of you, and that's unenlightenment, so we don't do that. Mindfulness-based stress reduction, so I got my letters backwards on that one, but that's a specific relaxation type of technique focusing on being present and in the moment, being mindful. And they've done studies showing that improves mood and stress, quality of life, and immune function. Yoga has been shown to have positive benefits. Support groups have been shown to have positive benefits. So I'm just trying to give you sort of the 50,000-foot overview of integrative medicine and some of the benefits. And so there's lots of good research here on mind body. And now moving into nutrition, just a small helping, Louise. I love your cooking, but I have to cut down on saturated fats. So nutrition in cancer, we are always going straight for what's the right diet, but let's not skip over some of the basics. Obesity is the biggest controllable risk factor, so it's been associated with a higher chance of getting lots of different types of cancer and a poor, not as good outcome after a cancer diagnosis. So weight loss, if you need to lose some weight, is good even after a diagnosis. Alcohol is another dietary factor that is a controllable risk. And then the specific nutrients, and again, because it's a short talk, I just wanted to highlight, so what's the bottom line on some of the research that's out there? So fat might be good, fat might be bad, especially bad fat. Red meat might be bad, fruits and vegetables are good, and fiber is probably good as well. And the AICR is an excellent resource. So that's the American Institute of Cancer Research, and they're focused on nutrition in cancer. So it's AICR.org. Lots of great tips and lots of recipes. You can sign up for a weekly recipe, and they're delicious and nutritious and easy to make. But basically, this summary is from them. Try to aim for a healthy weight, a plant-based diet, lots of fruits and vegetables and fiber, lower bad fats, less omega-6 fatty acids, more omega-3s, limiting alcohol. I also want to give a plug for our dietitians at the Cancer Center. So we have a dietitian that works with us in integrative medicine, but if it's a nutrition and cancer question, from what do I eat if I have mouth sores all the way to I'm done with my treatment, I want to prevent a recurrence, give me some tips on how to do that. The dietitians at the Cancer Center are an excellent resource. Of course, the questions that we typically get are, should I take supplements? Does sugar feed the tumor? Do I have to eat organic? And is soy good for me? So these are more kind of integrative medicine, nutrition questions. And just for time, I'm going to skip some of these. Let's just get a quick poll, though. Do you have to eat organic? No. No. Is it good? Probably, yeah. So I think that's what our dietitians would say as well. And maybe the reason organic foods are good is there may be more nutrition to a food that's grown and has to make its own pesticides rather than getting sprayed with them, more so than the actual pesticides themselves. Although I just heard a report that maybe they're not more nutritious. So I think, the press is still out on that one. Should you take supplements? Yeah, maybe, depending on where you are in treatment and what your goals are. Does sugar feed the tumor? Yeah. Does it feed your immune system too? Yeah. So there's balance there as well. Is soy good for you? Depends. So I did answer them after all, I guess. It depends, but we can come back to any of these if you have questions. I wanted to move into that one, should you take supplements? So here's a cartoon. What herbs should I drink to help me sleep? And that depends on whether or not you want to wake up again. So just to remind people that just because it's natural doesn't mean it's safe. So was it Socrates with the Hemlock Society? Hemlock, that's natural, not safe. Tobacco, that's natural, not safe. These things, natural, not safe. Okay. Lots of people use supplements. So how many here have used a supplement? Okay, more than 60% of this room. I like to think of them as medications. There's prescriptions, there's over-the-counter medications, and then there's everything that sort of falls through the cracks, dietary supplements. And unlike prescription or over-the-counter medications, a product that's classified as a supplement doesn't have to be shown safe or effective before it's sold. And there is some requirement that the manufacturers have to be using good manufacturing practice, but the burden of proof to show that that's not happening is on the FDA, so it's a little squishy. And so you can get some variability in the concentration of ingredients. But there are some good supplements, and there are reasons to take supplements. And I'd just like to highlight people looking for this symbol on their products. So this is basically sort of a mark, it's like a good housekeeping seal of approval. So if you find the USP mark on your supplement, it means that the product has the ingredients it says it does, in a form the body can use, has been made according to good manufacturing practice, and doesn't have any contaminants. So it's basically done in a consumer reports fashion, pull the product off the shelf, test it, meets the standard, you get to put USP on the label. In general, and this is very wishy-washy, and there's always specific situations, but I'd say maybe avoid supplements during treatment, because there's a lot we don't know about drug interactions with treatment, and it's been said that antioxidants might decrease the efficacy of some certain types of chemotherapy or radiation, but there are others out there who feel that it actually can make the chemo more effective. So it's one of these fuzzy areas that we're have an open mind about, and hopefully there are more and more research coming out. But there are some supplements that can directly inhibit the effects of chemotherapy, we know for sure, like St. John's wort is the poster child because it speeds up the metabolism of about 40% of the medications that are out there. And then there are some supplements that increase bleeding risk, so you have to be careful with them as well. A very quick bullet point list on my favorite supplements. The omega-3 fatty acids are anti-inflammatory. Coenzyme Q10, I don't know if you're planning to talk about that at all, but there's some evidence that might help protect the heart. Glutamine can help protect the digestive system. Probiotics, we already mentioned them briefly, but they may be helpful as well. Ginger has some good research to show if you take some ginger 3 days before chemotherapy and through your infusion, it may decrease nausea. Melatonin, helpful for sleep, and we mentioned that already. And another plug for the dietitians at the Cancer Center. So we also have a pharmacist who talks to people about drug-herb interactions and talks to people about specific herbs and supplements. But the dietitians at the Cancer Center, if it's a supplement that has anything to do with cancer, they are your go-to people. They are incredibly knowledgeable about the supplements in cancer. So I refer anybody with a cancer concern and supplements to the dietitians at the Cancer Center. So now something a little more fun. What's this practice here? Yep, so you're seeing some massage, and this particular massage is called Tuina. So it's a specific massage type. This is auricular acupuncture. This is cupping. Here's some more Tuina and some herbs and supplements. So this is the whole traditional Chinese medicine. So we talk about acupuncture, and we sort of leave out the rest of Chinese medicine, but Chinese medicine is much more than just acupuncture. So those other techniques are involved as well. A shout out for acupuncture during treatment for sure. It's definitely helpful for reducing nausea and vomiting. And generally we tell people to come in within a 24-hour window of their infusion. So up to 24 hours ahead of time to 24 hours after the infusion to reduce nausea and vomiting. It's also been shown to decrease hot flashes, whether it's because you're on an aromatase inhibitor or tamoxifen, or you're on androgen deprivation therapy for prostate cancer, any of these situations which can cause hot flashes. Acupuncture is definitely worth a try. It can be helpful for neuropathic pain that you might have after chemotherapy, joint pain with aromatase inhibitors, mood issues. Depression has been shown helpful for mild to moderate depression. It might be good for the immune system, and it's been recommended for dry mouth as well. So if there's something, I think acupuncture is probably my go-to therapy because there's evidence, at least some evidence, for its use in a lot of conditions. And so if you're going to try acupuncture, I generally say to people, try once a week for 5 weeks if it's a condition like neuropathy. And if you've had no response, then that's a good trial. If you've had a good response, work with the acupuncturist to spread out the time between visits, and they'll teach you things that you can do on your own, because our whole philosophy of care at Integrative Medicine is return the care of the patient to the patient. So we have one of our massage therapists here, Ann Matthews, sitting in the front, and we'll talk about massage, but she's great at suggesting sleep positions to people and how to creatively use a tennis ball and things like that. So we try to maintain the benefits you might get in our center when you're back home. And if it's okay, I'll take your question in just a couple of minutes. Okay. So massage therapy has a lot of benefits: relaxation, improved quality of life. It can be helpful for depression, anxiety, and sleep. A few things people don't think about: if you've had surgery, massage therapy can help you heal faster after surgery. It's definitely on the standard of care for lymphedema treatment and definitely helpful for pain management, and it is safe for patients with cancer to have massage. And I think massage in general is, if you have a whole host of medical issues or medical concerns, come to see a medical massage therapist like Ann, because she knows how to adjust her technique if you've got a low platelet count, if you've got cancer metastatic to your bones, and so forth. And plus, she's good for general relaxation too, so if you are well and you want to stay that way, Ann is still your gal. But kind of the more medical issues you have, the more you want to work with a massage therapist who's knowledgeable in how that affects technique and so forth. So just wrapping it all up, what the health? Integrative medicine is the coordination of lifestyle approaches and CAM approaches with conventional care. Don't forget about the lifestyle approaches. They're so accessible and they put you in charge. Avoid the harmful CAM therapies. Use those that are safe and beneficial, and consider everything that's at least plausible. Talk to your providers. The cancer center docs, especially here, are more than willing to listen and often refer folks over to our center, and I know the community cancer specialists are as well. And find good CAM providers. Of course, we'd love for everybody to be able to come here, but we know that's not practical for people, and if you have some interest afterwards, I can give you some tips on how to find people in your area. And use reliable information resources. So I have some information on the handout about how to get other good information. And lastly, be open-minded, but not so open-minded that your brains fall out. And thank you all very much for your attention. We have 1 minute left, so you get the question.
No, I was going to ask you, they put me on a blood thinner. My nose been bleeding a lot. Is there any alternative medicine for blood clotting and stuff like that?
So the question was, he said he's been put on a blood thinner and he's had a lot of problems with nosebleeds and things like that. And that reminds me to make a couple of points. Not answering your question yet, but acupuncture, for example, if you're on a blood thinner or if your platelets are low, acupuncture is still okay, but you may get a little spot of blood or a bruise, whereas people who aren't on blood thinners wouldn't have that. But that's one thing. And then somebody like Ann doing massage, very important to tell her that you're on a blood thinner, because she's not going to go all healthy on you, and she's going to give you a little bit of a lighter touch so she doesn't cause bruising or hematomas or things like that. As far as anything from the alternative medicine that could help decrease nosebleeds and so forth associated with being anticoagulated, I'd say not really, because anything that might help might be counteracting the effect of the anticoagulant. So from the nose standpoint, I just recommend things like topical Air gel, AYR. It's a good, you may be using that already. Yeah, you got that already. Yeah, and humidified oxygen and other things like that, just to keep your nose from getting dry. But nothing that I can think of from the alternative standpoint that would actually cut down on nosebleeds, but yet let the anticoagulants still be effective for you. And then every once in a while, I'll have people that come in and they say, I don't want to take the oral anticoagulants or Coumadin. Can I take a plant-based product or a supplement and be anticoagulated with that? And there are definitely products out there that will increase your tendency to bleed and may thin your blood a little bit, but we really don't know how to dose them to get that therapeutic effect. Usually we're thinking about it more as a side effect. So I don't think there are alternatives to the medications that are used for anticoagulation either. So I appreciate your attention again, and if anybody has questions, I thought I would have more time, but I don't. Happy to take questions by email. Would love to see any of you guys. So we've got our website listed here, and then my email is just lisa.corbin@ucdenver.edu, and I'm happy to take questions that way as well. And enjoy the rest of your afternoon.
Thank you.